Welcome. Have you noticed that one of your shoulders is lower than the other? Many of you have. Not only yourself, but I'm sure you've seen it in numerous people. You've seen them walk around like this to one side, you've seen them hunching over. There are many things that can cause a shoulder to become unlevel. But I want to review something very important about the spine. When you look at the spine from the side, normal lordotic C-shaped curve, kyphotic or reversed kyphosis of the thoracic spine, and a lordotic lumbar spine. So it should look like an S shape from the side, from the front. It should look actually balanced. Now what we're going to focus on right now is the lower back. If you see that the lower lumbar spine sits on the sacrum, little triangular bone down here. And this is the back part of you. As you can see, these are the spinous processes. Here is the right pelvis, here's the left pelvis. So you're looking at this spine as if I was turned around the other way. So this guy is facing me. Now you notice right in here, this particular area is called the sacroiliac, the sacrum and the ilium. You have two ilium, one sacrum, and the joint is called the sacroiliac joint. So when you walk, it rocks back and forth. Very commonly, these particular muscles and ligaments become imbalanced or become actually stretched or actually over-contracted from improper lifting, improper posture, weakness of core, just anything that will cause a tremendous amount of stress in this lower back, particularly those that spend a lot of time sitting. This can cause an imbalance of the sacroiliac region. Now you have nerves that come out. These are called the spinal nerves. This makes up that big sciatic nerve underneath here, runs down the back of the thigh, called the sciatic nerve, or sciatica is inflammation of that area. But generally what happens in the lower back area, as the pelvic rocks back on this side, the pelvic will generally go back and down. As it rocks up, it will come up and forward. That can throw the pelvic off, or one side will be higher than the other. So generally by looking at the foundation, if one side is higher or lower, generally the body will compensate as a result of that instability. Now the other difference is people who spend a lot of time carrying like a purse, a suitcase, or something on one side of the body repetitively, routinely, every day, that can cause a distortion of a scoliosis. It may even be a functional scoliosis where one side of the mid-thoracic area is overdeveloped as compared to the other, causing more hypertrophy and more contraction, actually pulling one side of the body lower than the other. So generally, those are the primary two factors, more from the structural part than from the physiological, biomechanical part. We're talking in the thoracic spine. The most important thing is, how do you correct it, or do you correct it? That all depends upon the etiology, where it's coming from. Is there any imbalances, or is there any nerve root irritation or compression or pain? The human body finds its ways to compensate naturally, and that's the time we don't want to fiddle with it. If we do something different that human nature is doing, we can stir up a whole lot of problems, a whole lot of inflammation, and potential situations that can give you lots of problems in the future. So if there's no pain, there's no inflammation, no nerve root irritation, and the body is functioning correctly, then obviously we leave it alone. But if you're having symptoms and you notice that the deviation is off, that particular imbalance, that spasming as a result of that nerve pressure, that pinched nerve that potentially could be going on, can be the reason why as well. So the answer here is finding a competent physician, a therapist, or someone who can analyze it so you can get this corrected. Leave your questions below. Subscribe, please, if you haven't, so you can continue to receive more educational material for you and your family. And most important, make it a great day. I'm Dr. Mandell.